Welcome back. It has been a minute since I was able to last do a video, and there's a good reason for that. My wife went through a couple of surgeries. Well, went through a surgery and then a post-op issue. And so we've had some fair experience with hospitals. So that leads me to today's topic, being an advocate for yourself in the hospital. So let me give you a little bit of background. She had the hip replacement surgery and then had some complications. We went back into the hospital. And when we went back into the hospital, the first day, the doctor told her, well, the doctor told the staff, supposedly, no food, no drink, nothing, just in case he had to take her into a surgery. And it caused a lot of frustration because she was post-operative by only about a week and a half, had pain medication for the hip replacement, so she was not able to eat, drink, or have any of her pain meds. The next day, the doctor came in and wanted to have a conversation, and the conversation started out very simply with him saying, we're just going to keep doing what we're doing, nothing else. Hospital staff had been telling us before that the doctor was driving all of this, and it sounded like he was until we decided to push the issue. And what we learned was the doctor was not going to take her into surgery. He didn't think that was even a possibility. He was saying no food and no drink, but when we pushed the issue and asked him why, especially if we're not going into surgery, he actually relented on that and said, well, you can have certain types of food. And then as far as the pain medications went, he didn't want to give her any of her pain meds for the post-operative surgery, which creates a lot of pain. And when we pushed the issue on that, we found that, well, he didn't want any interaction. So they had to do a little bit of research and find out that the pain meds that she was given, one of them was one they were unfamiliar with because they didn't use it in the hospital, but her other doctor that did the hip replacement was a doctor not only of doing hip replacement surgery, but he was also a doctor of pharmacology. So we had a little bit more trust in what he was doing. So by doing a little bit more research, we were able to get food, medications, and some liquids in her and make the hospital stay a little bit more pleasant. So here's what we've learned. Here's a few takeaways, and I'm going to share something here in a second, but the number one tip that I have is if you're going into the hospital, take someone with you and make sure you are your own advocate. The reason it's important to take someone with you is you may be undergoing medical procedures. You may be in a lot of pain. You may be in a medicated state where you shouldn't be making decisions. You couldn't drive. Why would you be able to sign away different rights and whatnot for yourself? So having someone who can be an advocate for you, and then also making sure that you don't take everyone's word just at face value because you have input. Only you know how you feel, and you may need something different than the generic care that you're being given. Not that hospital staffs do anything wrong. However, they have so many things going on, and they have a standard procedure that may not be right for you at that time. So I went through Manus and had Manus build this cool little website by asking me some questions, and it put this whole thing up. And in fact, I'll actually put the tip in the description. But this is 6 tips for patient advocacy. And not all of these I'm going to agree with 100% because, again, this is something that Manus put together. Let me blow this up a little bit. But I wanted to walk through these, and I'll share what I like, what I don't like, and my tips for making your hospital stay more effective. Number 1, be prepared and organized. Now, this doesn't always work. When my wife went into the hospital, she went in an ambulance. So that you can't really be prepared and organized to that point. However, after that, you can. And what this is talking about is bring a notebook and pen. Write down the names of doctors, nurses, and specialists. Now, I've noticed that the hospitals we've been in lately, they actually have a whiteboard that they will write this down for you so that you know who your doctor is, your nurses, and your specialists. Now, this is important because on staff, of course, hospitals have a number of different doctors and nurses. Sometimes different doctors will come into your room and cover for the other doctor, and every doctor's got an opinion, and every nurse has an opinion, and some of their opinions are different than yours. So the critical thing is to make sure you know who your primary care doctor, or your primary doctor is, not your primary care, who your nurse is and who your specialist is. You want to know the medications, the dosages, schedules, changes. This is something that we noticed that would be going on with even the medical dosing, where they would have a medication that they should be giving her, and specifically for pain medication when you're in some of these high-risk situations, these high-pain situations, and the nurse wouldn't show up for 30 minutes, 45 minutes, an hour. We'd have to go out and ask them, what is going on? Can we get this dosed, this medication that we're supposed to have? And they'd be like, oh yeah, I don't know what happened. And so sometimes things do fall off their schedule. It is important for you to be watching the schedules, as well as sometimes the medication would have already been given and someone would come in with that medication and say, well, we're supposed to do this. Well, they weren't supposed to do that, so you want to make sure that you're watching those details. Blood draws occasionally. We had a couple times where the blood was supposed to be drawn so that they could keep tabs on her vitals, and the blood draw didn't happen. So again, hospitals are busy places. You need someone on your side who's watching these details as much as they are. Hospitals do a good job overall, but sometimes the little things can make a big difference. Asking for business cards, that can be important, but it's more important when you're seeing doctors who you'll be going home with and following up with. Sometimes they have nurse lines on those that you'll be able to call after hours or at different times in the day instead of having to wait, go to the hospital, or whatever else. It's sometimes nice to be able to call a nurse, ask for what's going on, and a lot of those business cards have that on it. Communicating effectively is one of the most critical pieces. Sometimes we think communicating means just understanding what they're saying. That's not always the case in the doctor's world. Sometimes we have to communicate effectively. So for example, with that doctor that came in and said, well, we're just going to keep going with what we're doing, which meant no food, no water. We were already at 24 hours and he wanted to go on 48 hours. We had to be very assertive and very clear that no, that is not what's going to happen. Especially if there's no need. If she was going back into surgery, absolutely, we understood that was a need. However, with clear liquids, they only needed 6 hours or 8 hours or something like that on that front, and we would ask those time frames. What is the time frame that you need if that had to happen? And then when we talked to the doctor and he said, well, we're not even going back into surgery, I'm not doing that, we had to be very assertive and say, well, if that's not an option, if we're not going into surgery, why can food not be given? Why can she not have something to drink? Why can she not have her pain medications? All of these questions that had to be asked, and once we got on the same page, we were then able to do it. Building rapport is important. That's something where, especially if you're talking about food, pain medications, the doctors and nurses need to be able to trust you to do what you say you're going to do. One of the biggest concerns they have is that you're going to sneak something in or you'll do something that would undermine what they're going to do, because there is a lot of risk with surgeries and medications and other things that are going into the hospital. And if they know that you may be assertive, but you're also strong, you're also reliable, and you're not going to do anything to undermine their work, that can be very critical. Voicing your concerns is something that we have had to do a number of times. When a doctor makes a prescription or when a doctor initially sees a patient, they don't necessarily know how that patient works. They've known him for 15 minutes probably by the time they leave that room, and things change. People are different. Something that we've had to do in a couple of different instances is we've had pain levels ramp up, we've had discomfort levels ramp up, we've had other issues happen, and we've had to have the nurse call the doctor, which may be uncomfortable for some nurses, especially if they're newer to the hospital and don't know the process. We've had to voice our concerns and insist that they reach out to the doctor, who is the person that is responsible for care, and verify different facts. We've had nurses tell us that they have called the doctor and they have not done it. So you've got to make sure that you're following up, you're being reasonable to a certain extent, but you're also voicing your concerns and ensuring that they are following through on what they're saying. This makes a good point. The hospital staff is very busy. Don't assume all concerns expressed to one staff member are relayed to others. And that's very true. You may be talking to a nurse that as soon as they walk out of your room gets called into an emergency, and your concern doesn't get relayed to anyone because someone else's life is more important than a discomfort concern. These things happen all the time in hospitals. So you've got to make sure you bring it up, and if it doesn't get addressed, you bring it up again, while still being understanding and respectful of their situation, but you are responsible for being your own advocate. Monitoring medications and care. This is something that does become very important at a hospital. In my wife's situation, when she was brought in with the ambulance and taken in, they asked her about her medications. Well, she was in excruciating pain, lightheaded, couldn't walk. All these other things are going on, and they asked her the questions. When I was able to get there and we had a discussion with the doctor, we followed up on some things, and we realized that not all the medications had made it onto the list. So that can be a problem. So maintaining a list of up-to-date medication, supplements, allergies, confirm new medications before administration, yes, that's all critical. Something that we were able to do that actually was very successful, and you've got to be careful with this, just like anything, but ChatGPT actually will keep track of your situation. So if you go into a medical situation, you tell it what's happening, you give it your symptoms, you list all of your medications, it will remember those across the conversation. And the next time you go in and you're told about a new medication, you can bring it in and ask ChatGPT, actually, does this have any conflicts with any of the other medications that I'm on? Not that doctors don't know what they're doing, but doctors are generally generalists. They understand the broad scope of things, but they may not understand certain individual pieces. So, for example, in our situation, again, when we had a new medication they weren't familiar with, they were hesitant to give that because they thought it might have implications, and they didn't really have time to go out and research. But when they were able to do that, they realized it was just fine. We were able to go in and know that information up front, present information to them. Now, not every doctor is going to trust someone's Google search for a good reason, but if you were able to do your own research and be able to have an intelligent, smart, and non-hostile conversation, you're going to get a lot farther than on either side of that. Than if you're hostile, they're just going to disregard you and treat you like someone that is a risk, because you are. But also, you're not just a sheep that is going to follow along and take whatever happens, because that doesn't always work out either. Which leads us to the second one: observe and question. If something seems inconsistent, you need to ask. So if you have a sudden change like pain, confusion, breathing, your instincts are going to be very good because you're experiencing it. You know if it's new, you know if it's different. Don't just blindly trust that whatever you're feeling is what the doctor knows is going on. Things change all the time. Everyone responds differently. Make sure that you know what's happening. And the last one, AI can track medications for you. So absolutely it can. Now, AI is not always right. In fact, it's wrong a lot, we're finding in our experience. But if it gives you a good starting point, it will do research for you and actually give you the sources for a lot of the research, and you can go check, verify, and make sure that that's accurate. And honestly, if you're sitting in a hospital room, if you're sitting in a hospital room for extended periods of time, you may not have anything else to do. So research can be a good thing to understand what you should understand. Now, what doesn't work in this situation, I wanted to walk through. Assuming all medications are correct, procedures will go perfectly without your oversight. No, that's not necessarily true. In fact, accidents happen all the time. Mistakes happen all the time. Make sure that you are tracking the details. The person that is with you, your advocate, is tracking the details. And don't be afraid to go out and ask the nurse for additional information. Don't be afraid to ask the doctor for additional details. If you don't understand what's going on, ask questions. They should be able to explain it to you so that you can understand before anything is done. This one we've already touched on a little bit: monitoring medication administration. Make sure that you're monitoring what medications are administered, and make sure everything is administered as appropriate and you're not being over administered, because both of those are things that we've seen happen. You can keep a log, and usually the hospital will have a log of that, but it's not a bad idea. If you have multiple medications being administered, track them, write them down, make sure that you understand what should be administered and when. And a lot of times we were actually writing it down on the whiteboard for different things that were supposed to happen, to make sure that we knew and that everyone else knew what should happen and when, and that kept the communication lines open. Here is something I've talked about several times already: involve a trusted advocate. Make sure that you have someone who's designated as your primary advocate, and usually that would be someone, in our cases, fortunately, we could have someone in the room at all times, and you've got one person to communicate. If you have multiple people you're communicating with on either side of this, confusion happens. And that's why it's important to have the logs, to have everything written down, and have someone who is your point of contact, so that the confusion is limited to one person, or at least the communication is limited to one person, to minimize the confusion. This does talk about utilizing hospital resources. I have not had a lot of luck with that, candidly. Generally, the hospital resources are overburdened, and they may not even know what options should be happening, because they're generalists again, and they're patient advocates, and they're not even available to talk to the doctor all the time. So it is best, in my experience and what we've seen lately, to bring your own advocate, to have someone that can stay with you, be available, monitor the details, because honestly the hospitals just don't have time, and they will not be able to do it as well as you can. And then understand discharge planning. Here's something that I'm going to jump to the last one first. Discuss with the staff, especially your doctor, what they're looking for prior to discharge. We've seen a number of situations where the doctor may not understand clearly what they're even looking for themselves. It's just, well, I'll know when I know. And what we want to understand, especially when hospital stays are very expensive in the United States, we want to know, what are you looking for, what's the goal, and how can we best work together to make this happen. So in my wife's situation, it was we want to see, they gave us certain things, and some were grosser than others because it all involves bodily functions. But being able to walk, being able to move, being able to not have different pain levels, being able to keep down food, which was interesting when they're not willing to give food. Those are the type of things you want to understand. And once you have those goals, then you can monitor those and work towards those. So for my wife, when they said you need to be able to move, she was able to understand, oh, it's okay to move, where a lot of times we may think, well, I'm sick, I shouldn't. So she was able to get up, move, walk, and make sure that she wasn't forcing herself, but she was able to do that and understand her situation so the doctors and nurses could see, yes, we're moving around, we're doing this, we're able to keep food down. All of those action items were critical to understand at the onset before we got too far into it. The next one is getting clear instructions. Clear instructions on the medications, follow-up appointments, what needs to happen, what do we need to be watching for now in the hospital as well as when we leave the hospital so we don't have to go back. Those are all items that were critical. And then what doesn't work is waiting till the last minute to think about discharge and leaving the hospital without a clear understanding of what needs to happen. Every hospital stay is going to have some element of confusion because you're in the hospital. You don't go there for fun. You don't go there for a normal procedure. So there will be a amount of confusion. You need to minimize that, but though by asking questions, having discussions, talking with your staff and understanding, okay, when I go home, can I do this? Can I walk around the house or do I need to stay down for a couple of days? Can I walk around the neighborhood or do I need to stay in the house for a few days? Do I need my walker, cane, whatever else it may be? These are all factors that you don't really think about, and it's not necessarily only for elderly people. This happens to people of all age groups, and understanding what should happen, what needs to happen, and what resources are available to you is critical. I hope this has been helpful. This is not something anyone wants to think about, but it is something that does happen. And when you go through it, hopefully it's something that can be less stressful and allow you to focus on healing as opposed to the all the pieces that go around it. If this has been helpful, please give us a like down below. If you'd like to see more content like this, consider subscribing to the channel. And if you know someone who may benefit from this, please do share. Thanks for being here. We'll see you on the next one.